Welcome everyone to the seminar series for the Transitional Artificial Intelligence Research Group here at UNSW. Today we have our presenter, Dr. Amit Krishan Kumar, whose Chinese name is Kun Lun, who is from my hometown, Fiji. And Amit has completed his PhD at the School of Automation, Beijing Institute of Technology, under the guidance of Prof. Yuan in Xia, and also co-supervised by me externally. And I recall that most of the PhD was done during his stay in Vietnam due to COVID-19. So Amit's research topic in his PhD was multimodal approach for clustering risk level in pulmonary fibrosis patients with respiratory data. And his interests are in areas of multimodal analysis, respiratory systems modeling, pattern recognition, computer vision, biosignal analysis, cymatics. And it's great to have Amit presenting today. Amit, you can begin. Thank you.
Thank you, Dr. Raitaj, for introducing me to all in attendance. I welcome you all to this presentation. As mentioned, my name is Amit Kumar, and today I will present an article which is titled Physics-Informed Neural Entangled Leather Network for Inhalation Impedance of the Respiratory System. And as Dr. Raitaj has mentioned, that this article was part of my PhD research, which is titled Multimodal Approach for Clustering Risk Level in Pulmonary Fibrosis Patients Using Respiratory and EMG Data. So the research basically used bimodal analysis using surface electromyography and spirometer to reduce alert fatigue in CDSS. There were 5 novelties in this research, which were labeled as bronze, silver, and gold based on creativity. There were 3 silver, 1 gold, and 1 bronze novelty, which was proposed in the research. And this article shows the minor or the bronze novelty, which is on entangled leather network. So firstly, I will begin with introduction. So in which I will talk about the physics-informed neural network, leather network, and continued flexion. In background, firstly, we need, before we know physics-informed neural network, we need to know what is scientific machine learning. So what is a scientific machine learning? So it is a technique where machine learning is combined with the scientific computing. And how is scientific computing integrated with the machine learning? So the answer is that the partial differential equations that govern a system are discretized for robust solution and reduced computational complexity. And there are many branches of SCIM, scientific machine learning, like physics-informed neural network. And the physics-informed neural network incorporates accepted laws of physics into machine learning. And there are many PDEs of partial differential equation that can be solved by physics-informed neural network. And some of them are Schrodinger equations, Burgers equation, Allen-Kyle equation, Thermal-Wind equation, Navier-Stokes, micromagnetism, Black-Scholes, Baron-Blatt, elastic conservation of momentum, mass, and energy for compressible flow, Boltzmann equation, Fokker-Planck, and Poisson equation. So it's a good idea to apply PIN for modeling human body system, because they also deal with the partial differential equations. PIN is a meshless approach and can be applied to microstructures. However, the physics governing human body is complex, and the complexity is maybe due to nonlinearity. The nonlinear nature of any system dynamics is due to the measurements and observation, which is restricted by the observer's dimension. So the basic idea would be to a symmetrical model for evaluating the inhalation impedance in the conduction zone using physics-informed neural network. And so this is how we came up with the idea that we were using we needed to model the respiratory systems, so we needed something that could uh, do the work faster than the conventional approach. So we decided to use spin. There are many key terms related to my research, and in this work we mostly look at these key terms, which is Navier-Stokes, LiDAR network, physics informed, respiratory impedance, isotropic strain, entanglement, and clinical decision. The methods used in this work for the physics part of the respiratory physics are partial differential equations, where we apply pin. And for experimentation, we use initial conditions and we select some boundaries. And for output, for approximation of the impedance, we use entanglement and LiDAR network. So a brief description of physics-informed neural network. As mentioned, it is a scientific machine learning method. It was first introduced in the year 2019, and it deals with the, differential equations. It incorporates some accepted physics laws because, as the name goes, physics-informed neural network, so it uses the laws of physics. It's a meshless approach and has low computation compared to numerical approaches like finite element methods. It learns from the loss function of the data and the physics-driven approach. The optimizers we have used in this method are LBFGS B, and since it has a beta convergence, and we used the Swiss and logarithmic hyperbolic cos activation function. So this is a simple framework of PIN, which uses data-driven network and physics laws. So in the data-driven network, there are some data, and in the physics laws, we have initial condition, partial differential equation, and boundary condition. So the objective is to minimize the loss from the both of the network. The general form of the differential equation has a boundary distinct to the domain, and this is the equation where D is the differential operator, B is the boundary condition, F is the solution, lambda is the associated model parameter, and G, the function G for Z and time, T is the time-dependent force in the Z direction. So Z in this case is the axial direction, and next is the loss function, J theta, where JL is the PDE of loss function and JB is the boundary loss function, and WL and WB are the associated weights. And then we have the square errors, which is dependent on N, the collocation point. To further this research, we use some mathematical formulation, and we noted that it should obey the first law of thermodynamics, continuum, conservation of mass, and linear momentum. So this is the general form of the differential equation, and the parameters are given as follows: velocity, time, gradient differential operator, Laplace operator, pressure, density, viscosity, and this is another equation which was integrated with the flow equation. This deals with elasticity, and these are the parameters given. So first, this is about initial condition where we take some sets of pressure and velocity, and then we combine them to have many combinations of pressure and velocity, and we apply that to our system, and we get if we have 25 combinations, then we get 25 sets of impedance for a single generation. Then we go to the next generation. So I will explain about generation in later slides in the anatomy and the physiology of the lungs. So this is how we go on doing, evaluating impedance for different initial conditions for a single generation. The next, we select 200 axial collocation points in axial direction and evaluate the size of single mesh. We find the total points for every boundary and normalize all boundary points using maximum. So in this diagram, for this research, for this article, we can consider diagrams A and C, which is for inhalation, because in this case, we are dealing with inhalation impedance, and B and D are for exhalation. So this is part of my PhD. So in inhalation, you can see that uh, the generations of there are 200 boundary points at this mark, and there are another 200 boundary points. And as you go up, the boundaries decrease. But for exhalation, it's opposite. So the are 200 collocation points for G1, and as you go to G0, the collocation points increase. So for inhalation, we're going from G0 till G1 and G2. So this G0 and G1, they represent the generation. And as you go to higher generation, the collocation points decrease. That also state that the mesh sizes, there are not enough data there are not enough data points when you go higher to the higher generation. And this is a simulation of velocity and pressure for different initial conditions of elasticity. So next, I will discuss what is impedance. So impedance, if you have done electrical electronics engineering or some basic physics, so you can know that it is voltage divided by current. Or simply, we can say it is the potential divided by the flow. So in this case, the pressure is the potential and the flow rate, volume flow rate is the current. And it is dependent on the velocity and breathing. The flow rate is dependent on the velocity and breathing rate. And these are the underlying equations related to impedance and the different components of impedance, resistivity, inductance, and capacitance. As I mentioned, I will discuss about generations. So you can see this. There's a diagram on the left. This is for typically how a lung branches out. So we have starting point is 0 and we go till 23rd generation. There are 23rd branchings, 23 generations. So it's from 0 to 23, 24 generations, sorry, from G0 till G23. And they each have different length, radius, thickness, branching angle, and cartilage fraction. The radius, thickness, and cartilage fraction values, they decrease as you go deeper into the generation. The length and the branching angles, they vary for every generation. So in this case, we have model the conduction zone, which is from G0 till G16. So somewhere might be here. And the rest of the respiratory tree is called the respiratory zone, which is from G17 to G23. So at the end of this tree, respiratory tree, there are around this many alveoli. And if you want to find the total number of branches within the respiratory or within the lungs, then we can get an approximation using this formula. This is the physiology of the lungs. So when we are inhaling, we're going from the conduction zone from G0 till G16, and then from conduction zone to the respiratory zone, and then to the blood. And exhalation is the other way around. So we're going from the respiratory zone to the conduction zone. So that was about the different generations of the lungs. And now I'll discuss the respiratory impedance. So, and the LEDA network. So a LEDA network is a network with circuit elements connected in a repeated fashion. It can be finite or infinite. It applies continued fraction. It can have a converging solution or diverging solution. And it can be in parallel series or combination of both. So these are typical diagram of a LEDA network. So let's say we have got three elements represented with triangle, square, and circle. You can see it is repeating for a finite series. So it can be considered as a LEDA network. It's a repetition of some elements. So it forms a LEDA network. So this is a overview of the respiratory tree. So first is the trachea, Z0, which is the generation 0. Then it divides into 2. We call it bifurcation. And then next is from here onward, the division is 3. So it's called trifurcation. So this is how a respiratory tree looks. So we are modeling the conduction zone, which is from Z0 till Z16 or G0 till G16. And the rest we're dealing as a transmitter or transceiver, because the reason we are doing this, we did only for conduction zone, is because there's a different physics related with the respiratory zone and the blood. And the physics are the physics related with the respiratory zone and blood uh, with the blood are more complex than the physics related with the conduction zone. So in conduction zone, we can have a laminar flow. We can consider a laminar flow, but in respiratory zone, we can have a turbulent flow and mixed flow. So it's more hard to grasp the physics of respiratory zone. And one more reason is because for respiratory zone, it is hard to uh, model with conventional approaches, since the mesh size is very low, or it's like very, very small. And it's just like the mesh size is negligible in the respiratory zone. So the same LiDAR network is now represented as continued fraction. So in continued fraction, you have some fraction repeating for finite series or infinite series. And this expression is the normalization of this above continued fraction. And the parameters are given as here. So just note, if this is over here, I've used the variable m and variable n interchangeably, because in my PhD, I've used m for the denominator and n to denote the generation. But in the article, I've used the other way around. N is for the numerator and m is for the generation number. So we have a new variable here is called the psi of n. So from psi 1 till psi of n, so it is a coefficient that indicates the entanglement between Zn minus 1 and Zn plus 1. So let the difference between two impedance be for different generations be denoted as Z delta, and the ratio be denoted as Z delta with a triangle. Then we have approximated our impedance to be given by this, as we see, because the Z delta is always greater than 0. And how we evaluate the impedance based on the collocation points, we take the individual ratio of the potential with the flow rate, and then we take the parallel in the radial direction, and the overall results is then summed up in a series equation, and we get this equation. So this is how we use each collocation point to get the impedance for a single generation. So we do this for many generations, and we input it into the LiDAR network to get the overall impedance of the conduction zone. And this slide shows different components of the impedance, and can be seen that the reactance is highly affect the impedance, and resistance is that it does not affect the impedance and as much as the reactance. In these results, we show for 9 different combinations of velocity and pressure. We have low velocity and low pressure, high velocity, high pressure, normal velocity, and normal pressure. And we evaluate the square errors. So someone who is in mathematics will ask, like, why haven't we used the expression shown here to evaluate the impedance? Because the respiratory tree is a branching, it's less of a ladder network and more of a branching tree. So could it be because branching angle differ for each generation? So is it hard to evaluate impedance at high generation? Or because of a short circuit path in the ladder network, which is entangled? Or for transition from symmetrical to asymmetrical model? So looking at this question, firstly, initially I applied this equation in my PhD, but it doesn't give a good solution for all this. Somehow relate to this question. The branching angle is differing for every generation. As we go, the angle differ. and it's hard to evaluate impedance for higher generation because the mesh size decreases. So it's hard to evaluate. And the short circuit part in ladder network is entanglement. So it means that we put a value psi of n so that the impedance is can be approximated correctly. And the next is for transition from symmetrical to asymmetrical model. So the reason is for transition from symmetrical to asymmetrical model. In this case, we are using psi of n as value of 1, so which indicates symmetrical model. And as we alter the values, so we can get the approximation of an asymmetrical model. So in this case, we are treating the left side of the lungs same as the right side of the lungs. But in practical, it is not correct. So this model is restricted to symmetrical model of the lungs. However, it gives correct approximate the clinical values correctly, but we have not used some of the things like mucus, which is been left for future works. And another equation which I have used, what parameters of impedance can be deduced by evaluating the isotropic strain during flow? So we've used two types of equations. One is isotropic strain and Navier-Stokes for flow. So is it resistance, capacitance, inductance, or memory resistance? So the resistance is dependent on the geometry of the lungs. So as we breathe, the lungs expand. So the geometry also changes. And so the best answer over here is capacitance. So as we breathe, the lung capacity change. And if we are able to expand the lungs fully, that means we've got high total lung capacity. So the isotropic strain evaluates the capacitance of the lungs. So in conclusion, uh, so pain is a fast and robust way to numerically analyze flow for different breathing tests. The ladder network converges and gives good approximation of impedance. So for FOT, or the field force oscillation test, the gamma ladder network. So our ladder network is named the gamma ladder network because of the way it looks. And it has nodes connecting two consecutive generation and is supported by symmetric coefficient. Each generation impedance is normalized. The approximation of impedance terminates at the 16th generation for each combination of initial condition. Findings and application. The breathing maneuvers and therapy can be designed using using the initial condition, the result from different initial conditions. And PIN is a fast meshless approach for analyzing flow in pulmonary airways. The gamma ladder network saves effort and time in evaluating impedance at each node of respiratory tree. The initial velocity and pressure affect the impedance. Varying the flow rate and pressure of breathing help in reducing inhalation impedance. The ventilator can be designed to adjust flow and pressure by 20% to improve breathing. The respiratory impedance model, the limitations, the many limitations. The respiratory impedance model is for symmetrical model, and it can be extended to asymmetrical model. The impedance model do not evaluate diffusion in respiratory zone, so we've restricted this to conduction zone only. So we can say that we have not modeled for the entire respiratory tree. It's just only the conduction zone. And the model is only true for 75% total lung capacity in normal adults. And physics-informed neural network does not completely rule out computational fluid dynamics for the first few important generations, because computational fluid dynamics is also able to approximate correctly if the mesh size are large, but as the mesh size becomes smaller, then the computational time using the conventional approach also increases. So PIN does not completely rule out CFD for the first few generations, maybe for generation 1 and 0, 1 and 2. But then from there onwards, the mesh size is very small, so we can apply PIN for other generation. The number of combinations of the initial condition tested are not high, so we've used 9 combinations of velocity and pressure, and it can be extended to more combinations. The results are applicable to a small group of subjects, which is middle-aged adults with 75% total lung capacity. The hidden states in this model can be investigated by introducing the mathematics of cilia and BST, biochemical system theory, which is the future direction. A symmetrical model will be more practical than symmetrical model. Instead of using the integer order PDEs, you can try fractional ordered PDEs. So which is again a challenge. And other machine learning, scientific machine learning techniques exist like deep or net and Fourier neural operator. So this can be tested. And bidirectional series flow can be investigated. So as I mentioned in one of the slides, that this is for the inhalation only. So the next is the exhalation. But the problem is that exhalation starts from the respiratory zone. So respiratory zone, as I mentioned, has a is very small in geometry. So the mesh size will be also small. If we have the large mesh size, then there will be less collocation points. And the transceiver respiratory zone and blood diffusion physics can be approximated. That is, the respiratory zone um, can be modeled for the future research. Okay, so that brings to the end of my presentation. And I hope it was good and informative. And I thank you all for your attention. And I would be very happy to welcome any comments, suggestions, and questions. Thank you. And there are many people who I would like to acknowledge for this research. Professor Wang Xingxia, Dr. Tas Chandra, and this article was got help from some interns from Indian Institute of Technology, like Rita Majumdar, who proposed physics informed neural network for this for modeling the respiratory zone for the respiratory system. And then the experimentation was furthered by Snigdha and Sharon Jain. Thank you.
Yes, and submit. So we'll take some questions.
Okay.
I
It is a
have
question.
question. You mentioned that using physics informed.
Maybe you can come here because.
Audible?
Is he audible? Can you hear him?
Yeah, I can hear him, but it's like little, the voice is not very clear.
Yeah, I wanted to ask, like, did you happen to compare your physics informed neural network with finite elements? Because what I've seen is that neural networks tend to require a lot of data, but like, how does that play out in finite elements? Something like that.
Okay, thank you for your question. Yes, the only way physics-informed neural network beats finite element analysis or computational fluid dynamics is in terms of computational complexity. So as I mentioned, like I don't know if we can rule out CFD at the moment. So in this research, I mentioned that we cannot rule out finite element methods completely because it is accepted by many researchers, and it works for many models. And for numerical analysis, finite elements is still working better. But in terms of computational complexity, then PIN can be preferred. And the thing is, in this respiratory system, we are using a small mesh size. So when we try finite element for mesh size, which is very small, and then it takes a lot of time to evaluate for each mesh and the collocation points, because if you evaluate for whole of the respiratory tree, so different generation have different length and geometry. So there'll be different collocation points, and there'll be high number of collocation points to deal with. So it only we can say that PIN is good for it's a good approximation for just as finite element, but it is computationally it beats a finite element in computational complexity. It has a low computational cost. So I
Uh,
hope that
Yeah, thank you for your answer. I was also wondering, I didn't fully understand what the ladder network is. Is it similar to a recurrent neural network, or how is it different from that?
LiDAR network is you can say it's a combination of impedance. So if I can show you the it's I have not shown in this presentation. So if you look at this, okay, let's see this. Let's look at the okay. So this is the respiratory tree. So we are evaluating impedance for 16 branches. So in LiDAR network is, you can say that these are the this is one branch. So each node, there got many nodes. So there'll be 16 nodes, and there are lots of elements connected to it. So it is a network which in a repeated fashion. So it's not recurrent because we apply continued fraction. So for LiDAR network, we apply this equation. So it can be finite or infinite. So yeah, we don't get any feedback in this. It's just they're just inputting the values of each impedance in this equation.
It's not getting feedback.
But where is the neural network part encoded is what I'm wondering.
It's the neural network is in the physics informed neural network. So there's the PDE governing the equation. So with PDE, with the pin, we get impedance for single generation. And then to get the overall impedance of the conduction zone, we apply LiDAR network. So there are lots of branches, so we can't. So we need to get some approximation. So we need
Is each component in a ladder
yes.
network a neural net?
No. Like for each generation, we apply the PDE and pin. We get single impedance. Yeah.
And that is constructed in form of a ladder, right?
Yes, and then we form a ladder with that one, and we get the overall.
So each of Z of t that you've pointed out there, it's a neural network?
Yes. Yeah, it's a neural network prediction. Yeah.
Okay.
So yeah,
Thank you.
Okay,
I
very
think,
interesting. Yeah. Others, any questions? Yeah, I think it's very interesting the way the ladder network is constructed and the comparison of the ladder network with the recurrent neural network in the discussion. I think the other thing that one thing I found missing probably it's in the paper was the results comparison of the pin without the pin. Did you do that?
in the we did for finite element method and finite element method and pin. So those were the two methods we compared. So that was the only comparison.
Yeah, I wonder if can you use a non-pin like multi-layer perceptron ladder network for this?
Yeah, it can be applied, but then I mentioned that the respiratory tree is very complex. So this is a symmetrical respiratory system. So if we look at the respiratory tree, we know for the first 4 generation how the respiratory tree looks. But as you go deeper, then I don't know if the doctors know how exactly a respiratory tree will look like. So this is something for that first we have to know the exact geometry of the respiratory tree. Then we can apply.
Okay, thank you. Okay, I have one final comment. If you could tell a bit about what we are doing at the moment in the follow-up one.
Can I come up with the question again?
The current paper that we are writing, that you are doing with me. Yeah.
In the current article I'm doing with him, because this in this article we the equation we use is Navier-Stokes with isotropic strain for axis symmetric cylindrical tube. So in this tube, there's no mucus at the moment. There's one diagram I've shown. where I show the components of impedance, and I show mucus as a control current. So now we are trying to evaluate the flow of mucus, because the mucus also plays a very the mucus also affects the impedance of the lungs. So sticky mucus, a patient with sticky mucus or mucus that doesn't flow well will have a very high impedance, and it will be hard for that patient to breathe. So that is what we are doing now. We are now going deeper to the mucus level, and then we are now
We
evaluating
have some
impedance.
new methods we are using, the deep learning method.
Okay, in the deep learning method, we are now comparing with the tabular network, physics informed neural network with tabular network. And as I mentioned, future can be applied with deep net and Fourier neural operator.
Okay, thank you very much. This was really insightful and will motivate other researchers, hopefully. And all the best.
Thank you.
Of the report. Thanks.